Joining us now from Bronson, Battle Creek, one of the newest additions to their staff, Dr. William Spencer, is with us. Good morning, Doctor.
Good morning.
You've just come to our community from Beaumont Hospital over on the east side of the state.
I have. I worked there for 28 years, my whole career, and I was in a large group that we kept merging, and 45 urologists all over the city, and a big 1,000-bed hospital I worked out of. But I felt a calling to serve a different area, smaller area that had a need, and so I've been here 6 weeks working with the Bronson unit and two of the urologists in town, Patrick Srini and Kevin Bruton. So it's been a very nice change and underway here for 6 weeks.
Well, we're glad to have you here in the community, and Prostate Cancer Awareness Month is upon us. I was rather surprised at how common this has become.
It is. It will affect about 1 in 9 men in America in their lifetimes, which makes it the number one diagnosed cancer among men other than some surface skin cancers, basal cell and squamous cell. Now, that being said, we can diagnose the vast majority very, very early stage, and the treatments are highly effective. So it's all about early detection. That's just paramount.
Yeah, and I remember my dad had this a few years ago and has recovered completely. But what I learned was it's maybe one of the slower growing forms of cancer, which is good for diagnosis and treatment.
That's true, and most all the time. And one of the nice advances we've really focused on about the last 8 years is a group of men, and that's now about a third of the men diagnosed, where we don't have to treat it up front. They enter active surveillance, and we follow them several times a year and maybe do another biopsy a year later, an MRI. And that group may be able to defer treatment for up to years, and as long as they're under surveillance. So that's been a nice advance.
Now, for men out there listening, when should they have a prostate exam?
Yes, and there are some guidelines that have come through our national organization and Cancer Society and so forth. So it's interesting. So we don't think men under 40 need to be screened, and men between 40 and mid-50s would do it if they're at a higher risk group, and we can talk about that. And then the most effective group to be screened, the target group, is between ages 55 to 75. And above 75, have to individualize it. The higher risk groups are men who have a family history of prostate cancer. They are of African American descent. And we're focusing on a group also that has a family history of some other cancers, might be genetically related, breast, ovarian, or pancreatic. So all of this falls under this category called shared decision making. It's talking to your primary doctor or the urologist about the screening and the pros and cons. But the real target group's between 55 to 75.
And there's basically, what, 2 tests?
Very powerful, very easy test. There's a rectal exam, simple rectal exam once a year, and the PSA blood test we've had since the early 90s. And that combination is very powerful. It will find the vast, vast majority of prostate cancer in the early stages.
So you should have both and not one or the other.
Yes, yeah. Sometimes there's a little confusion on that, but the two need to be done together, and they're very easy to do, very powerful combination.
Dr. William Spencer from Bronson, we really appreciate you being with us. Welcome again to the community. Nice to talk to you this morning.
Well, thank you so much. My pleasure. Glad to be here.